Okay, we'll try to round up some folks, come back in from the break. We're going to start here very shortly, if you'll find your place. Well, I think the last session demonstrated that good things happen when you're able to attract the A team as presenters, and I think the next one's going to show what happens when you can get the A+ team. So we'll continue the trend here this morning. This next session is going to be moderated by Jim Whitehead. Jim is a member of the Roundtable on Obesity Solutions and is the Chief Executive Officer of the American College of Sports Medicine, a position that he's held since 1990. Time flies, huh? Jim.
Thanks very much, Russ, and thank you all for attending or for viewing. We appreciate it, very important. It's my pleasure to introduce, and I've really been looking forward to this, as I have with all the sessions. We're going to have an exemplary panel on community strategies for promoting physical activity, which is the session. And there will be two individuals as the panel, Dr. Jim Sallis, who's a member of the Roundtable on Obesity Solutions and is Distinguished Professor of Family and Preventive Medicine at the University of California, San Diego, and Director of Active Living Research. He'll be joined by Dr. Abby King, who's a professor of health research and policy in medicine, the division known as the Stanford Prevention Research Center at Stanford University School of Medicine. Jim will be talking about active living communities, and Abby will be talking about technology applied to this area of physical activity. And this is to be a bold discussion that we're going to have, and it's about innovation, it's about connectivity, it's about creativity. And I just want to, before asking Jim Sallis to come up, I want to give you three quick quotes that we can use as we want to. Two are inspired by Albert Einstein, whose iconic statue, of course, is associated with this facility. And he said, Dr. Einstein said, if at first the idea is not absurd, then there's no hope for it. So if something doesn't quite fit with you at first, please, you can label it absurd. We're in good company here, but you'll be hearing new things and exciting things, innovative things. Secondly, from Dr. Einstein, the secret to creativity is knowing how to hide your sources. So we can learn all kinds of things, potentially, from Albert, but I think what the context of that is really to draw from all kinds of things, and those things together really do combine to be creative and innovative. And then lastly, moving from the good Dr. Einstein to Oscar Wilde, an idea that is not dangerous is unworthy of being called an idea at all. So we're going to be looking at things that may strike some as absurd, may strike some as dangerous, may strike some as an amalgamation of lots of other things. But that is what a panel and a discussion and a focus on innovation and creativity is about. So you're going to enjoy this, and let's get started. Jim Sallis, please come. Thank you.
Thank you, Jim Whitehead. Is this working? Okay. Pleasure to be here. I'm also honored to be on this program, and it's exciting to have 2 days on physical activity. So I'm hoping to emphasize more of the dangerous and less of the absurd here. But I'm hoping to give you some ideas and some evidence that you can use. So I am going to be suggesting some relatively innovative solutions I don't think are going to be absurd. So we're going to be talking about the built environment here. Because this is how we believe we can create long-term, permanent solutions that help everybody. So this is what I want to go over. Do built environments matter? A bit of evidence there. I want to give you some progress in research and policy. I have some policy good news for you. Here's the main topics. A little overview of designing walkable communities, designing streetscapes for people at a more detailed level, re-engineering active commuting to school, and designing active parks. So I'm going to give you samples of research. There's a lot of evidence we have now about these, but I'm just going to give you some a little bit. I want to focus on disparities in activity-friendly environments because that adds to our to-do list. We have some difficulties there. And I want to end with the co-benefits of active-friendly communities, which I believe is going to tie in very well to the discussion in the previous panel, and then end with resources. So these are stamps. And you know, remember the Elvis stamp? Elvis, that was an icon of American culture. Well, these are on a series called the American Landscapes. And now, if you think about how much of our landscape is covered in residential subdivisions and highway interchanges, then you get a sense of the massive scale that the built environment and the policies driving the built environment are affecting. And to me, the evidence is pretty clear that these particular types of built environments are really creating danger for physical activity. And so think about your feet. So people have had feet since people were people. And what have we used them for? We've used them for walking, to get to place. All right, that's our history. That's how we were built. We decided that was not any good. So we decided let's change that active transportation. We don't want that. That's old-fashioned. So let's build our communities with residential subdivisions here, so that people live here in every place they want to go far away. All right? So that you can't walk to get from where you are to where you want to go. And so, I think that's been pretty effective in reducing active travel. But if you really wanted to do a better job, you'd say, well, let's spend trillions of dollars to create dangerous situations, so that if people walk, they're likely to get killed. And so then you have on the right a highway interchange that was designed for one thing. And that is meeting the transportation goals of the United States of America. And that transportation goal is to move as many cars as fast as possible. And you can see that the highway interchange is a brilliant way to meet that goal. But you can also see there are no people on there. And that's for two reasons. It was designed to not accommodate walking or biking. And in fact, from a policy point of view, walking and biking is against the law on interstate freeways, as you all know. So, and the other thing you might notice is in the residential subdivision, there's no park. So it makes problems for leisure time activity too. So right here, encapsulated in these two stamps, are, as I think of it, one of the reasons why Americans are among the least active people in the world, and just coincidentally, also the most obese. And the importance of built environment is emphasized here because of this word, forever. right? So you see these things are going to be around a long time. So anyway, that's a little introduction. So we do know how to create places where people can walk to destinations so beautiful that they want to walk around. Here's an example of such a community in the United States. It was designed a long time ago. And this is how we design our places now. Maybe not so beautiful, not designed for pedestrians. Yes, you can walk, but this poor guy who's doing it, you can see that he's putting his life at risk by walking, trying to make the healthy choice. Okay, so I just want to give you a snippet of evidence about this. We've been working on this, and the link between community design, the overall design of your community. This is a study we worked on some time ago, and we measured physical activity with accelerometers after recruiting people from different kinds of communities. And you see the green is high walkable. So some of them look kind of like this, and some of them are low walkable and look more like that. And we tested this in low-income and high-income communities to see if we saw similar effects of walkability. And we adjusted for lots of things, including self-selection, as Lowell mentioned. So you can see that people living in walkable neighborhoods are 5 to 7 minutes more active every day, objectively measured. And it's significant, and there's really similar patterns for the low-income and high-income, which is good news because it looks like walkable neighborhoods are effective for both. But you might think, well, 5 to 7 minutes a day, is that a big enough effect to really drive changes in zoning policies and transportation policies and that sort of thing? Well, maybe, maybe not. But let's look at the possible public health impact of 7 minutes a day. More physical activity, or 50 minutes a week. That's about 2 miles more per week. That's meeting a 30-minute per day guideline, almost 2 more days per week, on not just in participants in a program, but in essentially everybody on average in a community for as many years as they live there. So 2 miles per week is about 100 miles a year. 100 miles per year times 100 calories per mile, about 10,000 calories a year. So rough estimate, 10,000 calories a year could prevent weight gain, theoretically, of about 3 pounds. And so that's certainly more than the average weight gain. So just from the neighborhood you're living in. And so, consistent with that, we see lower obesity rates and overweight rates in the walkable communities, and pretty substantial differences at that. So I think that's a little evidence. Not all the evidence is this clear or consistent, but that's just what we found. But in our studies, we found the same thing pretty much in adolescents, and working with Abby King, we found very similar results for older adults. So we see this going across the age range. Okay, a policy bright spot here. Jamie Shrieky talked about zoning codes, and form-based codes are a newer type of zoning code that's more about the shape of the buildings, the design of the buildings, rather than the use in a particular area. So in fact, it encourages mixed use, where people can live near shops, near jobs, near schools. And so if you take a look, this is showing adoption of form-based codes over the years, and you can see just in the past couple of years, it's really shot up. So these are becoming more common. They're being adopted across the country. And over time, these should drive changes in the way we build our communities in this country. Okay, so let's go on. So let's go on to the transportation sector. Somebody brought up transportation. This is what we call a complete street. It's designed for places for bicyclists, for walkers, for drivers, for transit users. This is a beautiful example of this, and you can can see it's pleasant too. It's got aesthetics, trees, shade, that sort of thing. They really specialize in these kind of streets in Bogota, Colombia, which is where this came from. All right, so this is America, how we design places here. My colleague Neville Owen and I thought we'd take a walk from a physical activity meeting in Atlanta, home of CDC, and so we walked a couple of miles, and then we said, okay, I guess they decided we'd had enough pampering with sidewalks, and we could rough it from here on out because there's no more sidewalk there, and that's a little embarrassing and annoying. But look at this. This is downright dangerous. Trying to take the little girl out for a walk and take the baby, and again, should you have to put your life in danger to go out and take a walk? Well, anybody in favor of that? Okay, probably not. But that is the situation that we have for millions upon millions of Americans. Okay, so let me move on to something else that's a little bit newer in a sense, and it's paying attention to what we call the micro scale. The land use, the zoning really covers the macro scale. Once you've laid out the roads, once you've laid out the buildings, it's really hard to change that. You kind of have to scrape them off and start over. But what could we do in a shorter timeline and in with less money that might encourage walking? So I'm going to present some of our data on micro scale features, and these are both places that are nicely designed for pedestrians. So I'm going to talk to you about just introduce what we call our MAPS Mini. So this is an observational assessment where you walk down the street and you identify what's there. And I'll show you what the items are. So we started out with 120 items, which was not the mini version. We narrowed it down to 15 items. So that's a length we think could be used by practitioners, by advocates, so that we learn a lot more about how our streets are designed and what that might be doing to people's experience as they walk around. So we selected these items based on correlations with physical activity, guidelines from various groups, and whether they're modifiable or not. And we tested these in over 3,500 children, teens, adults, and older adults from 3 regions. So this is a little snapshot of the results with the boxes showing where the significant correlations are with active transportation, walking or biking for transportation, adjusted for walkability. So we're trying to narrow our focus on the easy to change things. And the darker the color, the more significant it is. And so I put in red those variables. And so here are the 15 variables. It's actually 14, but we want to add one variable on bicycling facilities, which was an oversight on our part. But the ones in red are significant in 3 of the age groups. Street lights, benches. Well, benches, that's a little odd, but maybe the older folks want a place to sit down, or maybe the parents want a place to sit down and watch their kids play. Having a sidewalk, well, that's comforting to show. I think that's basic infrastructure for active living. A buffer, that means that there's something between the traffic and the sidewalk. You know how much fun it is to be walking along a sidewalk and have a semi-truck, mirror breeze by your ear. Not really encouraging more walking there. So this is a grass strip, maybe parked cars, something to separate the pedestrians from the traffic. Curb cuts, great for people with disabilities, great for older people, great for people with strollers, great for little kids who have trouble with the curbs. So that was great to see. And what we found is, so not everything was related for everybody. And you see, it looks like getting the details right might be most important for children and adults, and a little bit less so for seniors. But when we looked at what we call the the grand score, just focusing on the active transport related variables, this was significant. The overall score was significant across all of these age groups. And here's one of the takeaway messages. This is, we graph the relationship between the MAPS mini score, or how pedestrian friendly the streetscape was, and the active transport outcome. And this is just one sample. It's linear. Okay, it's linear, and so you say, big deal. But I think one of the lessons that this says for me, if you just improve your streetscape a little bit, you get a little improvement. But if you make it excellent, if you make it as good as you can make it, you're going to get a big improvement. So on a percentage basis, this was over a 200% difference between the worst in walking for transportation, comparing the worst and the best places. So here's a bright spot. Jamie, I think, mentioned complete streets policies, and here's the adoption of complete streets policies across the country. It's gone up tremendously. It's about 600, and you see it's really picked up in the past few years. So here's a policy that's more or less consistent with evidence that is being used around the country. So now we have to study more about the quality of that policy and whether it's actually being implemented and money is being put to building new places. Okay. Now, so here's the unfortunate situation with active transportation in youth. The line that you see, the one line that's going up is car travel to and from school. The line that has gone down the most is walking and biking to school. And you can see kids, more than 40% used to walk or bike to school in the 60s, and now we're down to about 10 or 12%. So Safe Routes to School is an initiative, a movement to try to improve this, because safety concerns is definitely the biggest barrier, and it's traffic safety concerns that are the biggest barriers to walking and biking to school after distance. But the distance, what's that related to? It's related to zoning and separating schools and putting them out of the neighborhood. So this is very relevant here. This is a Danish study. Kids who walked and biked to school were about half as likely to be overweight or obese. So there's really two solutions here. One, put the schools where the kids are. All right, so instead of on the cheap land on the edge of town that nobody can walk to, generating more traffic, more pollution, put the schools in the middle of the community. All right, and then create safe routes to school. And so here's some kids walking to school, and there is, now we have some evaluations. I'm going to show you one evaluation of Safe Routes to School funding on a national basis. This is in five states. And you see, what were those, what projects, how did they change the infrastructure? Very simply, they mostly built sidewalks and they improved crosswalks. Very basic, sensible things. And what happened? 40% improvement in walking and biking to school. Almost all of that in walking. 40% improvement. I would say that's pretty good. That is pretty good. And there's another study showing the longer that these improvements have been in place, the higher the active transport to school. So it just keeps getting better. And so is this a policy bright spot? The 2005 federal transportation bill had funding line item for Safe Routes to School for the first time, and it allocated $1.2 billion for this purpose, and 14,000 schools received funding. So that's the good news. The bad news in red is a lot of states didn't use their funding. They never gave it out to schools. And then in 2012, the MAP 21 cut out the Safe Routes to School line item, cut highway funds by 30%, and the question is, what's going to happen in the new federal highway bill, transportation bill in 2015? A little bit on parks. People who live near parks are more likely to use them and be active. Here's one study showing that. The more recreation facilities in the neighborhood, the more active kids are and the less likely they are to be overweight. And where people are most active in parks are on tracks and sidewalks, on the linear elements. So here's some evidence to say that we should be making sure that we have these linear elements in parks. Rails to Trails Conservancy is doing this. They've gone from 250 miles to 21,000 miles of rail trails. So I just want to say the bad news is there's disparities in a lot of these variables. Lower income neighborhoods have less street lighting, fewer sidewalks, less traffic calming, and fewer marked crosswalks. So I'm going to just go to my, I'll leave you with this. We just published a review or an exploration of the literature looking at the impact of, or the co-benefits of designing places for active living. And you can see the types of settings that we have here. And we showed, in general, if you design a place to promote activity, you're going to get better physical health, mental health, social health. More environmental sustainability, meaning less pollution and fewer greenhouse gases, and economic benefits. As we heard, that's what the policymakers are interested in. Thank you for your attention.